What I am about to share with you has the potential to completely change the way you think about every single blood pressure pill sitting quietly in your medicine cabinet. If you are currently taking amlodipine, losartan, or lisinopril, there is a genuine possibility that a symptom you have been dismissing as aging, stress, poor sleep, dehydration, or simply one of those days could actually be your body trying to tell you something important about how your medication is affecting you. That is the part that worries me the most. People rarely get into trouble with blood pressure medications because they were prescribed irresponsibly. Most complications happen because patients were never fully taught how to interpret what their body is telling them after they start the medication. The danger does not usually begin with a dramatic emergency. It begins quietly, with subtle clues that are misunderstood or ignored. I'm Dr. Emily, and if you have been prescribed amlodipine, losartan, or lisinopril to control high blood pressure, there are essential things you need to understand right now. Not because your doctor intentionally withheld information, but because the modern medical system often allows only brief appointments. Explanations are compressed. Questions get postponed. Patients walk out with a prescription and basic instructions, but without a deeper understanding of what the medication is doing internally. That knowledge gap is where confusion grows, and confusion is where risk quietly builds. Let me tell you about Eleanor. She was 72 years old, organized, responsible, and incredibly consistent. She took every dose exactly on schedule. She monitored her blood pressure at home. She attended every follow-up appointment. Within 2 months of starting amlodipine, her blood pressure readings improved beautifully. On paper, her treatment looked like a success story. But 3 months later, she came into my office worried because her shoes felt tight by evening. Her ankles were swollen. Her legs felt heavy. She feared her heart was failing. Her daughter worried about kidney disease. No one had clearly explained that the same medication improving her blood pressure could also cause predictable ankle swelling. Amlodipine belongs to a group of drugs called calcium channel blockers. Losartan is in a class known as angiotensin receptor blockers, and lisinopril is an ACE inhibitor. All three lower blood pressure, but they do so in entirely different ways. That difference is not academic trivia. It determines what kinds of side effects you might experience. Amlodipine relaxes small arteries, which helps blood flow more easily and reduces pressure. But those small arteries relax more than the veins do, especially in the lower body. Blood can flow down into the legs efficiently, but it does not always return upward with the same ease. Pressure builds in the tiny blood vessels of the ankles, and fluid leaks into surrounding tissues. The result is swelling that often becomes more noticeable by the end of the day. People wake up with relatively normal-looking ankles, only to find sock marks pressed deeply into their skin by evening. Many patients misinterpret this swelling. They assume they ate too much salt. They think they are gaining weight. They fear their heart is weakening. Some feel embarrassed and stop wearing certain shoes. Others quietly skip doses on days they want to go out because they do not like how their legs look. That is how a manageable side effect turns into uncontrolled blood pressure. The swelling itself is not usually dangerous, but the silence surrounding it can be. Lisinopril works differently. As an ACE inhibitor, it interferes with a hormonal system that regulates blood vessel constriction. By blocking part of that system, blood vessels relax and pressure decreases. But this same pathway affects a substance in the body called bradykinin. When bradykinin levels rise, some people develop a dry, persistent cough. This cough is not dramatic or wet. It does not bring up mucus. It feels like a tickle in the throat that refuses to go away. What confuses many patients is that the cough does not always begin immediately. It might appear weeks or even months after starting the medication. By then, most people do not connect the two events. They blame allergies, air conditioning, acid reflux, or seasonal changes. They buy lozenges and humidifiers. They change detergents. Meanwhile, the cough continues quietly, interfering with sleep and energy levels. It is important to distinguish between that dry cough and something far more serious. In rare cases, ACE inhibitors like lisinopril can cause angioedema, which is swelling beneath the skin, often involving the lips, tongue, face, or throat. If swelling affects breathing or swallowing, it becomes the medical emergency. A dry cough may be irritating, but swelling of the tongue or throat demands immediate attention. Understanding that difference prevents both unnecessary panic and dangerous delay. Losartan, often prescribed when someone cannot tolerate lisinopril's cough, blocks a related hormonal pathway but through a different mechanism. It tends not to cause the same cough. However, both losartan and lisinopril share another important characteristic. They can raise potassium levels in the blood. Potassium is an essential mineral that helps regulate the electrical activity of the heart. Too little potassium can cause problems, but too much can be equally dangerous. What makes this tricky is that potassium hides in places people do not expect. Salt substitutes often replace sodium with potassium. Many heart-healthy seasonings contain added potassium. Electrolyte powders, meal replacement shakes, and certain supplements can increase intake significantly. I once cared for a gentleman who was diligently trying to improve his diet after being diagnosed with hypertension. He switched to a salt substitute and used it generously, proud of his commitment. He was also taking losartan. Over time, he began feeling weak and slightly nauseated. Occasionally, he noticed his heart skipping beats. Routine blood tests revealed elevated potassium levels that required urgent adjustment. He had not been careless. He had been proactive. The missing piece was education about how his medication interacted with his new dietary choices. Monitoring kidney function is another area where misunderstanding frequently causes fear. Losartan and lisinopril can actually protect the kidneys in many patients, particularly those with diabetes or early kidney disease. However, when these medications are started or doses are increased, blood tests sometimes show a small rise in creatinine or a slight drop in estimated kidney filtration rate. Patients who see these lab results online before speaking with their clinician may panic and assume the medication is damaging their kidneys. In some cases, a significant change does require adjustment. But a mild, expected shift can simply reflect how the medication changes internal pressure within the kidney's filtering system. The key question is not whether a number moved, but how much it moved and what the overall trend looks like. Hydration adds another layer of complexity. If you are taking losartan or lisinopril and you develop vomiting, diarrhea, fever, or heavy sweating, your body's fluid balance changes. The same dose that worked perfectly when you were well can lower your blood pressure too much when you are dehydrated. Dizziness, weakness, and even fainting can result. Kidney function can temporarily worsen under these conditions. Many patients continue taking their usual medication dose during illnesses because they believe consistency means never missing a pill. In reality, sick day plans are part of responsible medication management. Knowing when to call your clinician for guidance can prevent unnecessary hospital visits. Over-the-counter medications create another silent risk. Non-steroidal anti-inflammatory drugs such as ibuprofen and naproxen are commonly used for joint pain and headaches. When combined with an ACE inhibitor or ARB, especially alongside a diuretic, these pain relievers can reduce blood flow to the kidneys. This combination has been nicknamed the triple threat to kidney function. Each medication alone may be reasonable. Together, particularly during dehydration, they can create significant stress on the kidneys. Because these pain relievers are available without prescription, many patients do not think to mention them during appointments. Dizziness deserves special attention, particularly in older adults. When starting or increasing blood pressure medication, it is common to feel lightheaded when standing up quickly. Blood pressure that has been high for years may feel normal to your body, so lowering it can temporarily create a sensation of imbalance. However, even a brief episode of dizziness can lead to a fall. A fractured wrist, hip injury, or head trauma can change the course of a person's life. Standing slowly, sitting on the edge of the bed before rising, and monitoring persistent symptoms are practical steps that make a real difference. Another common mistake involves reacting emotionally to single blood pressure readings. Blood pressure fluctuates throughout the day. Stress, caffeine, pain, conversation, and even anxiety about the measurement itself can influence the number. A single elevated reading does not mean your medication has failed. A single low reading does not automatically mean the dose is too strong. What matters is pattern. Measuring at consistent times, after resting quietly, provides far more useful information than repeated anxious checks within minutes of each other. Missed doses also create confusion. These medications are designed for steady, long-term control, not rapid correction of occasional spikes. If you forget a dose, Doubling up later without guidance can cause blood pressure to drop too low. Clear instructions from your healthcare provider about what to do in case of a missed dose are essential. Guessing invites instability. The most important truth of all is this: the best blood pressure medication is not the one that produces perfect numbers for a few weeks. It is the one you can tolerate safely and consistently over the long term. If swelling from amlodipine makes you miserable, if a lisinopril cough keeps you awake every night, or if losartan requires closer monitoring due to other conditions, adjustments can be made. Treatment is not a one-size-fits-all equation. It is a partnership. Side effects are not a sign of weakness. They are information. Swelling is information. Cough is information. Dizziness is information. Changes in laboratory values are information. Your responsibility is not to diagnose yourself, but to observe patterns and communicate them clearly. Too many people believe that being a good patient means never complaining. In reality, being a good patient means paying attention and speaking up before small problems escalate. Not every side effect signals catastrophe. Mild headaches when starting medication often fade. Temporary dizziness may improve as the body adapts. A manageable cough may be tolerable for some individuals. But there is a difference between temporary adjustment and ongoing suffering that erodes quality of life. Recognizing that difference requires understanding how your specific medication works and what warning signs truly matter. When patients understand the mechanisms behind their prescriptions, fear decreases. They no longer assume every symptom means disaster, nor do they dismiss persistent warning signs. They develop balance. That balance protects them. If you are taking amlodipine, remain aware of ankle swelling, flushing, and evening heaviness in the legs. If you are taking lisinopril, monitor for persistent dry cough and be alert for any facial or throat swelling that demands urgent care. If you are taking losartan, remember the importance of potassium monitoring and hydration, especially during illness. With ACE inhibitors and ARBs, regular blood tests are not optional formalities. They are part of safe treatment. Understanding replaces confusion. Communication replaces silence. And informed patients are far safer than those who simply swallow a pill without knowing how it interacts with their body. I'm Dr. Emily, and my goal is not to frighten you away from necessary medication. High blood pressure itself carries serious risks, including stroke, heart attack, kidney damage, and heart failure. These medications save lives every day, but they work best when patients understand them, respect them, and use them thoughtfully. When you combine appropriate medical guidance with personal awareness, you create a powerful layer of protection around your health. And that protection begins not with fear, but with knowledge.